Now, as the country battles a surge in COVID-19 infections, people with comorbidities, including diabetes, are at a high risk of severe illness and possibly death. Stellenbosch Health Care Specialist has launched a service to help diabetes patients to help mitigate risk associated with diabetes and COVID-19 from the comfort of their home. For more on this, I'm now joined by senior researcher at Stellenbosch University's Department of Family Medicine, Dr. Darcelle Schouw. Dr. Darcelle, good evening. Thank you very much for joining us tonight here on In Focus.
Good evening, Tabu. Thank you very much.
What have you noticed as far as patients with diabetes accessing the necessary support for health care at home during this time of the pandemic?
Okay, so during the coronavirus epidemic, people with diabetes are not attending support groups or clinics as such, and are not getting enough information or support with self-care. So we've therefore thought that providing the essential information via a WhatsApp bot might help people with diabetes during the pandemic, so they're not getting enough access to the services.
Yeah. Question has been asked, why are people with diabetes disproportionately affected by COVID-19?
Okay, people with diabetes who become infected with coronavirus are more likely to get severe disease and be hospitalized. And people with diabetes and coronavirus are 3 times more likely to die, especially if they are poorly controlled. And unfortunately, 1/3 of people with diabetes are very poorly controlled and 3/4 are uncontrolled.
Yeah. People say, well, this is a disease that essentially should be affecting the lungs. How does that then connect with the diabetes illness?
It affects the lungs. So what happens is diabetes is a condition in which the body does not produce enough insulin, or where the insulin does not function properly, resulting in high blood sugar. And when there's not enough, when there's the high blood sugar, then affects the organs, and one of the organs are the lungs that are affected, and are the serious complications can derive from that.
Yeah. And how then does effectively managing your diabetes at home improve your chances of going through COVID but surviving in good health?
So the best way to take care of yourself during COVID at home is through self-care, and that is why we developed the self-bot. And the best way is to manage your lifestyle and the control of your medication. And through the WhatsApp bot, we've developed the 16 messages within the WhatsApp bot. Essential information needed to avoid coronavirus and needed to improve the control of diabetes. So of the 16 messages, such as eating healthy food, looking at your portion sizes, doing certain types of exercises, aerobic and resistance training, understanding your medications, how to deal with low blood, how to deal with high blood sugar, looking after your feet, and various complications. So those are the programs that we share within the WhatsApp bot. So normally people would be able to access it via their health systems or their healthcare providers, and with the WhatsApp bot, with these 16 voice messages, they're able to access all the essential information via the chat bot.
Right. And is there a cost attached to this service?
There's no cost attached. So all they have to do is they save the number 087-240-5094 on their cell phone and send a message hi to that number via WhatsApp. Only 90 megabytes of data in total is needed for the entire 16-day program. Everything happens automatically once you sign up with WhatsApp. You register and you ask what language you want to use. So it's in 3 languages, English, Afrikaans, and isiXhosa. After you receive your 16 brief audio messages, and they're 3 to 4 minutes long, 1 per day for the next 16 days. And you can share this information or this number with your relatives and friends, and you can stop also at any time.
Yeah. Dr. Schouw, give us that number again.
The number is 087-240-5094. You save the number on your cell phone and send the message hi via WhatsApp. Everything else then happens automatically, and you will have access to avoiding coronavirus and improving the control of your diabetes.
087-240-5094. You say here of those 16 evidence-based audio messages offered to patients, they will also get information on how to avoid COVID-19 infections. What kind of information is contained there?
So types of information is, again, the social distancing, the washing of hands. With the new Delta variant, we know that it's not just droplets in the form of droplets, it's airborne. So helpful tips on how they can stay healthy, what they need to do. And so every message is accompanied by just a reminder on what to do for themselves in order to protect themselves from coronavirus. And it's specifically linked to their condition. So every message will have a specific and different message for their condition.
Now, you're one of the lead developers of this particular system. Have you seen it in practice, and what kind of feedback is it giving you, and as far as the advice that has been given, and whether or not it is effective in helping patients manage their diabetes?
So we've had an amazing response since we've launched the chatbot. So almost 1,000 people have accessed the chatbot at the moment, and almost 100 have completed the journey so far, which means they've completed the 16 days. We've had a great media response, and 76% have changed how they look after their diabetes, how they take care of their feet. So in the chatbot, they have an opportunity to say how the messages have impacted them. So to date, 76% have said they're taking better care of their feet, looking after their physical activity, how they've changed how they eat, how they deal with low and high blood sugar. And so we've also seen that 48% of it is Afrikaans speaking and 48% English, and about 2% Xhosa. Is it Xhosa?
Yeah. And what is the possibility then of expanding this particular chatbot to the other comorbidities also that affect people, particularly during this time of the pandemic?
So following the rollout of the WhatsApp chatbot, we're looking at the effectiveness of the chatbot. So to see what the effect the chatbot has on, so especially with diabetes, what the effect is on the HbA1c levels are. So we're doing further research that will take place after the launch of this chatbot to see what the effect was and getting the response from the users. And we'd like to roll it out to patients with hypertension, great for hypertension, great for COPD, for asthmatics, and great for stroke. So we'd really like to take this to all the comorbidities.
Now, what is the possibility then of having someone on the other side of the line? Because, of course, the chatbot, which means most of it is run by the technology. And if there are further questions and somebody wants an actual person on the other side of the line, does it provide for that?
At this moment, we don't have that facility. And yes, it would be very helpful to, at the moment, we're testing the chatbot and we're wanting to see how effective it is. And we've just rolled this out during COVID. So we and measure the effectiveness of it. We'd then like to also have a support system where people can call in and say, I'd like help. But that will be built into the future programs.
Darcelle Schouw, appreciate your time, and thank you very much for joining us tonight on In Focus, senior researcher at the Stellenbosch University's Department of Medicine there.